temporarily to fill a job that's vacant and then go back. But that has to have to do with a temporary biometric document. And then we've got to address the other, the issue of the 12 million people who are here illegally. Just a word about Mexico. They've got a terrific problem in Mexico today. And obviously their economy and many of their government policies are not what we would probably want it to be. And sometimes it's obvious that governments matter and it hurts their economy. But right now, they've got a big fight on their hands with drug cartels and drug dealers. The drug people have been killing off some of their top police and law enforcement people. And you know what they're trying to do? They're trying to stop the flow of drugs. Most of it, the destination is not Mexico, it's the United States of America. So I want to help them. I want to help them try to choke off the supply of drugs. I want to have a free trade agreement with Colombia, our best friend, who is fighting it to help us prevent the flow of this terrible poison into our system. I'm a free trader. But right now, I'd love to try to help the country of Mexico. As I said, some of their top law enforcement people have been assassinated, and they have corruption that has permeated their efforts, and I respect their president for trying to do that, and I want to work with them in that effort. Yes, ma'am. All the way in the back.
What are your plans to stop abortion?
I'm pro-life. I've had a long record. I believe the noblest words ever written are that all of us are created equal and endowed with certain inalienable rights. Among these are life, and I believe that those words apply to the unborn as well as the born. And I think it applies to people all over the world, not just in the United States of America. I want every American to know that adoption is available. I want people to understand that if a child is brought into this world, that we will do everything in our power to make sure that they have a loving family and a home. But I also want those children to be able to be brought into this world. And I believe we are slowly changing the culture of America and having respect for the rights of the unborn. So I will continue that effort. It was yes.
Senator McCain? We have very good health care for the most part, and if you can afford it in this country. Unfortunately, a lot of people cannot afford it, and they're the working poor. These people are working hard, and there's no help. And right now, there doesn't look like there's a way out. Do you have any ideas that can help address this quickly?
Yes, and it is until the issue of the gas prices came up, probably healthcare was the #1 domestic issue in America. It still is. It still is. As you mentioned, we have the best quality healthcare in the world in the United States of America, my friends. It's not the question of the quality of healthcare, it's the availability and affordability. And I'm not ready to have the government take over and make the decisions for the American family. All the American family can make those decisions. Another significant difference between myself and Senator Obama. I want to give every family in America a $5,000 refundable tax credit that they can take any place in America and get the health insurance that they need. I want us to have community health centers. I want us to have walk-in clinics. I want us to have outcome-based treatment of patients with chronic diseases. Five diseases, as you know, consume 75% of the healthcare costs in America. I want some government-approved plans that will insure those people that presently are unable, because of the, quote, pre-existing conditions, to receive that health care. I will work with the governors and the legislatures and others and provide that. But I am not going to dictate that the government decide what your health care is going to be. I'm going to leave that to the families.
Sure, I'm
I'm a retired Air Force aviator.
Thank you for serving. By the way, I don't have to tell you that it didn't take a lot of talent to get shot down. I was able to intercept the surface air missile with my own airplane. Thank you for serving.
Thank you, sir. My question is about the GI Bill. It's been recently, we've heard mostly sound bites in the news about a Jim Webb bill, and you've been criticized for not supporting veterans. Of course, you know that's not true, but can you tell us why you didn't support Jim Webb's bill and why the details of what you do support? Thank you.
First of all, let me say that I admire and respect Senator Webb for his service to our country. He's a brave American, and I have the greatest respect for him. In my years of service, particularly now, since we're asking these brave young Americans to go back and back and back to Iraq and Afghanistan, we want to retain and keep these experienced and talented people. And again, Colonel, I don't have to tell you, the heart and soul and backbone of our military is the non-commissioned officer. The non-commissioned officer is the person that's sitting right in this front row. They're the ones that inspire. They're the ones that are lead. Those are the ones that in battle and in peace and in war are the backbone of our military, which makes us a bit unique as compared to some other countries. The British have kind of the same system, but most other countries do not. So in order to have that incredible talent pool, which takes years and years to develop, as you know, I want people to stay in the military, and I want to give them incentives to do so. So our proposal basically is to have a scale of increasing benefits the longer you remain in the military. And that's what we're trying to do. And the second thing that we want to do